There is something that I wanted to ask you. Have you ever thought about where Houston's homeless get medical care and treatment? Well, just south of downtown, there's a clinic that provides free services, and one of its community health workers knows how to relate to them very well because he too was homeless but was able to turn his life around.
A lot of the services then fell off to the side.
Joseph Benson is a community health worker for a health care for the homeless clinic just south of downtown Houston.
How you doing?
He and more than a dozen other community health workers are licensed to provide guidance and referrals for Houston's homeless population seeking all sorts of health care.
Literally in the medical clinic, we have not only primary care, but we have psychiatry, we have case management, we have the community health workers. We also upstairs have a dental clinic, a full-scale dental clinic that not only does urgent dental care, but all the way through to restorative care, so dentures and partials.
And with a variety of services being offered here and at several other free homeless clinics in our area, it's community health workers like Joseph who are on the front lines dealing one-on-one with the homeless and their health care needs. His approach with clients has always been peer-to-peer because he experienced being homeless in the late 1990s.
Lost everything, lost family, home, business, everything. I just bottomed out. When I used to sleep under the Pierce elevated bridge, one of the things I used to say in my prayers was that if anyone come and help me, I'm gonna give service back to the people that I lived with.
He says it was hard to leave the streets and move away from homelessness because he was leaving friends behind.
You feel guilty because you made relationships with those people and you leaving them there and you going to get housing and working your way out of homelessness.
But being able to relate to the homeless and being able to make a difference in their health care has been very rewarding for Joseph. He still has to maintain a level of professionalism, though, even when dealing with friends.
You have to learn about client confidentiality because you can't discuss people's business as you do business with them, and you have to learn how to have boundaries. Even though they're your friend, you still have to make a difference between the individual that's your friend and when you're working with them.
And some of the hard work can be seen in the smiling faces of some of our city's former homeless who have transitioned back into society with the help of those in this clinic and other similar clinics that operate on donations from individuals and private companies and organizations. You know, I met Joe at a game, the Texans game, because he's usually downstairs in an area where guests are greeted before they go up to the boxes. And I just started chatting with him because he was so busy, and all of a sudden he said, "You know what I do on my second job?" No. And then he told me about this, and it's like, I have to talk to you.
I just have to ask you, what was a turning point in his life? Because we don't get to very often cover a story like this where there's such a turnaround, and what a blessing he has been to so many.
He has been a blessing because he was given the opportunity to get housing, so he didn't have to sleep on the streets, he didn't have to sleep in a tent. And by getting that, he was able to get other services and then say to himself, okay, I can do this, and he just kept going forward.
Now he's helping so many people.
He really is, he really is.
Maybe he'll help other people turn their lives around too.
Yeah, that's what he's trying to do.